Okay, I did my PowerPoint on HIV and AIDS, and the first slide I just wanted to talk about the triad, and it's going to start with the agent being HIV, the host being humans, and then the environment. It's going to be a biological environment, so mom to baby at birth, and then physical, so poor sanitary living conditions, and then socioeconomic, which would be like third world countries, since they just don't have a good place to live. So that would be a factor. Playing like a dirty environment might contribute to like hospitals using bad needles and giving HIV from a patient who came in and not cleaning their stuff right and giving it to another patient. It's a fun fact. I didn't know this, but countries such as like Africa who practice like just witchcraft and stuff, and they think weird things like, it says Africa commonly spreads HIV via widow cleansing, where a widow is expected to have sexual relations in order to cleanse herself after the death of her spouse. If she does not follow through, then the spouse is believed to come back and haunt the family. So that's one way that they see HIV being spread in Africa, and over 95% of the people living with HIV are in developing countries. So, like I said, with the third world country thing, it's seen a lot more there. And then 1 in every 6 infected U.S. citizens, they do not know that they have AIDS. So it's spread a lot because people just don't know that they have it, and they're having unprotected sex and giving it to their partner. So factors impacting the life cycle of the organism. HIV gradually destroys your immune system. So whenever you get it, you're going to be more apt to getting certain infections. So your immune system just keeps weakening and keeps weakening. So it affects these cells called CD4 cells, and these cells are a type of white blood cell that helps protect your body from infection. And then, thanks to improved treatment with HIV, people are now getting to live longer, and there's no way to ever get rid of it once you have it. And once you progress to a new stage from HIV to AIDS, you can't go back. So I'll talk later about the CD4 counts, but just keep that in mind. So people with HIV are now living longer lives, like I said, but you need to be able to stick to your drug regimen and just stay healthy so you don't get these opportunistic infections that do end up killing you. So start medical care as soon as you're diagnosed with HIV. So you don't want to put it off. The estimated sometimes that you will progress to AIDS later if you go ahead and get on the medications and go ahead and do what you're supposed to do in your life. Expectancy will be longer. And then, like I said, maintain a healthy life so opportunistic infections have less opportunities to harm the body. Okay, the incubation period from HIV to AIDS is estimated at about 10 years for adults, and sometimes even longer. So it has been altered since the introduction of antiviral medications and then the prophylactic treatment. The CD4 cell count, or the T cell counts, will gradually lower over time until the patient is diagnosed with AIDS. So our cell count, CD4 count, and any normal person who doesn't have HIV or AIDS, it's going to be between 500 and 1500. HIV is going to be 200 to 499, and then AIDS is anything less than 200, and that's really bad, and that's when they will diagnose you with AIDS, when they take your CD4 count and it's below 200. So routes of transmission and reservoirs is transmitted via body fluids, and sometimes people are misunderstood that you can get it by contact, but the only way that you can really get it by contact is if you have a break in your skin or mucous membrane, and someone with AIDS gets something in your cut, and it's mainly transmitted by body fluids, so blood, semen, vaginal secretions, amniotic fluid, breast milk. So a mom with AIDS can transport it to her baby. Dirty needles, pregnancy, those are the main ways that we see it. And then sexual contact. Population commonly impacted, drug users. So with infected needles, sharing needles, and just dirty environments, you're going to see them getting AIDS. And anybody who's sexually active, male or female, sometimes it's been said that gays get it a lot, but everybody's at risk if you're sexually active. and in contact with someone who has HIV or AIDS, infants born to an infected mother, people who are received an organ transplant, HIV infected blood, or a blood infusion product between 1978 and 85. So that was like before they really knew about AIDS that well, and they weren't really taking the same precautions we do now, so people got it that way higher then. And then race, so HIV is actually higher in African Americans than in whites. And then healthcare workers who come in contact with HIV and AIDS patients, if they were to actually stick themselves with a needle, but there's stuff you can do about that if that was to happen. And then the geographic distribution and incidence rate, I just stuck with the United States. So I just said in 2014, the estimated number of new HIV infections in the United States was, let me see the number, 37,600 cases. So that was in 2014. I don't know what it is now. That's the only one I could find. And then estimated annual HIV infections in the U.S. declined 18%. So it's declined some from 2008 to 2014, yes. So HIV and AIDS is emerging the most in African Americans, like I said, and that's 45%. And then whites, and that's 27%. And then Hispanic, Latinos, and that's 24%. So first signs the humans are going to see, and I wrote down that swollen lymph nodes is often a first sign of an HIV infection. Fatigue, fever, diarrhea, weight loss, yeast infections in your mouth, and shingles. It's just a lot of like infections because your immune system's getting weak. This disease is reportable. You must report it, and you have at least a day, a full business day, 24 hours, to go report that you have been diagnosed. Medications used in this treatment, it's the antiretroviral therapy, ART treatment. It just slows the progression from HIV to AIDS and helps you protect your immune system. And then pre-exposure prophylaxis. An example of that would be Truvada. It is a pill that is taken if someone has been exposed to HIV through sex, or like a nurse sticking themselves and they knew that they're going to get it. So they go take this drug, and you need to take it soon, like as soon as you can, and it has been shown to reduce it 92%, and so anybody who's in a risk factor group needs to be taking that. And then non-adherence is a huge problem because they have so many medications and they have to take them every day and they forget, so they need to be taught how important it is to take these medications. And it will also, when they're taking their medications, they need to still have safe sex, but they are at a decreased risk of passing it on to their partner. And then common side effects of the medications are usually kind of rough, so that's another reason people don't take it. So hepatotoxicity, nephrotoxicity, osteopenia, cardiovascular disease. So you need to let your patients know to be like watching out for these side effects. So precautions needed in the home setting and healthcare providers. Healthcare providers, they need hand hygiene, personal protective equipment, soil patient care, equipment handling environment control. Needles need to be disposed properly. And then people in general who are not part of the healthcare, they need to have safe sex, be taught about safe sex, or just be abstinent, use condoms right, and then like learn about like needles and how to use needles right, and just be educated. So the population focused intervention, so primary prevention would be like abstinence, just like not having sex, not sharing needles, using condoms correctly, just preventing it, so pre-exposure prophylaxis. The secondary is HIV and AIDS screening test, and then tertiary would be taking the prescribed drug regimen daily as they told you to, and not skipping any doses. And then I found a little commercial. It seemed kind of older, but I put it on there, the link on there. And then public health alert, estimated 1.1 million people are living with HIV in the U.S. And then, but new treatment plans have come out that have allowed people to live healthier lifestyles that are actually like enjoyable. And I just put make smart choices because your life is on the line. Because like one bad decision and you have this for your whole life. So that's all. Thanks.